Delegates outside, I request you please come in and be seated. In a few minutes now, we'll be starting with the fireside chat. Once again, here is a kind request to all the delegates. Please come in and be seated. It's the time for the fireside chat now. So I would like to request our dignitaries that they would come on the stage. But before that, you need to take your kind places. So I request all the delegates, please come in, be seated now. It's the time for fireside chat. Let me please share with you that we are going to have this fireside chat as a power talk on population stabilization as a key driver for quality employment and sustainability. So I request the delegates come in, be seated. It's the time we should move ahead. Once again, here is a kind announcement for the delegates who are still outside the auditorium. Please come in, be seated. It's the time for our next session, that is a fireside chat, and it is going to be a power talk. A very, very interesting session is coming up now. So I request all of you, please come in and be seated. Since my friends are joining inside the auditorium, I welcome you once again in this 7th International Conference on Sustainability Education. And now we are here for the fireside chat. So after this quick networking tea break, Shilpa Bhavna welcomes you back again here in the auditorium. And for this Plenary 9, we are having a big question to ask, and that question is too many to sustain. So this is going to be a power talk on population stabilization as a key driver for quality employment and sustainability. For this, I would like to invite the dignitaries on the dais. So firstly, please join me in welcoming Mr. Pradeep Burman, Chairman, Mobius Foundation. Please put your hands together for him. I request you, sir, to please come over here on the dais. And yes, one by one, I'm going to invite both of you. And yes, we have with us Professor Dr. Sonali Kar. So please put your hands together for her as well. She's from the Department of Community Medicine, KIMS, Keet University, Odisha. We welcome both of you. So Mr. Pradeep Burman is here, who is always committed to advancing sustainability education as the foundation for a better tomorrow. Let's have a huge round of applause for him. And before I hand over this fireside chat mic to Professor Dr. Sonali Kar, I would like to give a brief introduction of hers. So Dr. Sonali Kar is Professor of Community Medicine at Kalinga Institute of Medical Sciences, Bhubaneswar, with more than 15 years of academic research and ethics committee experience. She completed her MBBS from SCB Medical College, Cuttack, followed by a postgraduate certificate in Health and Family Welfare Management from NIHFW, New Delhi, and an MD in Community Medicine from the Himalayan Institute of Medical Sciences, Dehradun. So she has contributed extensively to capacity building in family planning and reproductive health, and as an author for the Ministry of Health and Family Welfare, she developed national training modules for ANMs and MOs and contraceptives, emergency contraceptions, and permanent methods, all of which continue to serve as a reference resource. So she's here with us. I would like to hand over the mic to her. Let's have a round of applause for Professor Dr. Kar.
A wonderful good morning to everybody. I think it's still morning time. And we started early. The stage has been set for this wonderful discussion since yesterday. I have been a patient and a very, very enthusiastic audience since yesterday. And today I enjoy the stage, introducing somebody who needs no introduction, perhaps. And I thank Mobius and Dr. Bhuj, Dr. Vijay Shri, to have extended this invitation and considered me as a partner in this very, very, very noble and essential initiative. Essentially, let me add a disclaimer that I am a learner, just like Dr. Rachna said, that this conference has brought together perhaps experts or maybe experts in making into a common forum in order to exchange some thoughts and build up recommendations for the future. So without any further delay, I would like to speak something on Dr. Burman, who is, I think everybody knows him by now, but just bear with me while I say that is an essential leader, a sworn environmentalist, and a crusader of sustainability. He is the grandson of Dr. S.K. Burman, the founder of India's largest Ayurvedic company, Dabur. Born in a family of innovators and philanthropists, he imbibed the leadership quality and has always been very passionately interested in social causes. To pursue his dream of leading the world towards a more sustainable future, Mr. Burman founded the Mobius Foundation in 2015 with the sole objective of promoting environmental sustainability. So I think we owe our presence here in this forum to Dr. Burman. So just to set the stage about what this discussion is all about, as I was informed, this is that the topic, which is very aptly titled, that the count goes on. So here we are going to talk on a very, very essential theme, that is a very essential and a very alarming theme of population. Now, we all know India's population has been its strength, but in the recent decades, it has also been one of the largest concerns for both the government of India and I think for everyone as to how the population has been growing exponentially in India. For just a little statistics, which I can credit myself as a healthcare provider, that India is the 7th largest country in the world, but offers habitation to almost 17% of the global population, and is almost the stage is set that it becomes the most populous country in the world by 2040. So having said that, let us hear from Dr. Barman, because I think he would speak more coherently and more passionately on this topic. Like, sir, what do you think? What happens to nature? And when I say nature, I think I mean environment, when this population keeps growing. So what do you think?
I think we have to go into the stage of evolution. The planet is, the cosmos, the entire universe is 13.5 billion years, and the Earth is maybe 4 million, and the civilization, which starting from agriculture, is hardly 12,000 years old. So the population that we had in 1800 was 1 billion, and the population we have now is 8 billion. Without the land mass increasing, we are cutting down the forests, and we are having confrontation with the biodiversity, that means essentially with the animals. And human-animal conflict is increasing because we are taking up their homes, and we are building concrete structures, which is also affecting the amount of water that we have. So the population seems to be driving everything. Whether it's climate change, or whether it's fossil fuel, or whether it's coal, population seems to be the driving force which is upsetting the balance in nature. When the nature is balanced, then it has to try to rebalance. But evolution doesn't happen in one day. It takes thousands of years. That's why I was saying from 13.5 billion to 12,000, and now from 1800, from 1 billion to 8 billion. So this is what is happening. We have to reset the balance.
Wonderfully said, sir, and very simply explained. Thank you. Now, sir has given us a very...
First, let me interrupt you and correct.
Yes,
I'm not a doctor.
Fine, sir.
I don't have any degree, doctor, so don't mistake me as a Dr. Burman, okay?
So I believe that degrees do not define a person. It's your experience that is...
Well, whatever it is, we have to make a correction. I should have made that correction first.
So very humble. And so having learned about the threats of population, let's hear from sir, because sir is a philanthropist, and the way he has explained it about evolution. We all have been talking about circular economy. Now he's talking about the cycle of life. Earth was unique because it had life. And now Earth is demanding care from the life that has been habitating it. So let's hear, like, sir, how do you think that leveraging technology, like we all are experts from diverse fields, we all are technical experts, so how can this be leveraged? And this unique terminology of green jobs, they can help make the future cool, safe, and resilient.
Well, technology is the key to reversing whatever we have damaged. And technology like AI, technology like recycling, that these are all new technologies. We have just had the occasion of plastics. Now, how do we recycle plastics? We can. We can do it with bacteria. We can do it with converting plastics into road material. There are so many ways. Now we've got AI that has opened up another thing, and each and every community around, as far as India is concerned, that's all I know about, is doing something about it. We are cleaning up the beaches, we are cleaning up the ocean, and we are doing all sorts of things to restore the balance, and all our collective ways we will restore the balance. And technology is the one that is the key to restore that balance.
Very lucidly put, sir. So now coming to the core of, or the theme of this discussion, which is population stabilization. Now, population stabilization is again a terminology which is now very much, very close to sustainability, and that is perhaps the reason why sustainability has gained ground. And what is this population stabilization? There are, in terms of quantification, what we want is that the population should not grow. And what determines the population is the birth rate and the death rate. So the birth rate and the death rate, if they are kind of nearly balanced, then the population does not grow exponentially. But what is happening in India is that the birth rate is very high, the death rates are going down because the healthcare has improved dramatically. The birth rate is also controlled, but the control is not unified across the country. So we have a target, a very simple target, which is called total fertility rate, or TFR. Now this is again going to be a little new to the audiences, because I know there are a lot of students here. And as a medical doctor, let me explain you what is the TFR. The TFR is that a woman of the reproductive age group, like usually we have a reproductive age group that is 15 to 49 years. And the expected number of children that a woman is likely to have during this period is 2. If it goes beyond 2, then there is a likelihood of the imbalance that Sir is talking about. So the government of India has laid down a target of having this TFR across states and even national average of 2.1, which means that the population stabilizes, that is quantifiably, it doesn't go beyond a value where we cannot cater to the population. But what I believe is that with the concept of the qualitative aspect of the stabilization is what is the dream of Dr. Burman, that is sustainable stabilization, which means that these people have good livelihoods, they have good air, they have clean air, they have healthy lifestyle, so that they can live longer and they can contribute to the country and to the world prolifically. So with that, with having given a little perspective of what population stabilization is, let us hear from Sir that why do you think is population stabilization important for India's future, and how is Mobius Foundation initiatives, like if you could just brief the audience about the project Aakar, which is going to offer tremendous hope in future.
So first, let me change the terminology. It's not population control, but it's population stabilization. We've already gone haywire with population control during the emergency, so that is why we try to avoid that. But let me go back to Independence Day. Independence Day, our population was 35 crores. And today our population is 140 crores. That is why there is need for stabilization. And at the time of independence, even Pandit Nehru was told by J.R.D. Tata that look at the population, and we have to be able to control the population, because he knew about Malthus. But from 35 to 140 crores, the land hasn't increased, water hasn't increased, resources haven't increased, because the resources are becoming less and less and less. That is why there is a need to stabilization of the population. Now the key, once here also, the key is education. It's women who bear the children and have to bring them up, so they will never want to have more than 2 children if they are educated. You see the example of Kerala. They are 100% literate, their population is down. So once you allow literacy to come into everything, this is one of the things that Mobius Foundation is doing, besides the Population Foundation of India and Janani and other things that we're doing for Project Akar, is that we have a 100 school program which is educating all the women. It's only girls' schools that we are in Madhya Pradesh and UP, all the places where what you said, the TFR rate is so high. It is all over 3 where we are present to deliver the contraceptives from them, even if they're uneducated. They don't want more than 2 children. If you provide the contraceptives and you provide the counseling and you provide the education, even a little bit of education, they will not have more children and it will be stabilized. But if you don't provide them the contraception means, then it will continue to grow.
Very aptly said. So what Sir, just like a true social scientist, has put forward, that perhaps women who are the cornerstone of development, they need to be educated. And to that I add another word, literacy. So like even today, like it's never late for education. We all, our generation, we are getting educated or literate about digital technologies. We were not exposed to these digital technologies perhaps during our times of education, but we are getting to know about it off age, and we are using it also for our betterment and benefit. So it's never late to get educated or literate. Similarly, if education is offered to these women at an age when they can decide, they can make an informed choice, like perhaps during their school-going adolescent age, then definitely this problem or this kind of situation, this problem statement can turn around. So Sir has very rightly not just said about it, but through his foundation, they all, as I hear, there is a panel discussion which is going to follow this chat talk, wherein they are going to actually display what they have done in those states of Uttar Pradesh and Bihar and how they have worked about it. So my next question is, sir, you already talk about women. We all are talking about women in India. So it's always great to learn that women are so important. And there is this great word also attached, empowering women. So I believe all social scientists like you, they have had this kind and very big foresight that perhaps empowering women and also involving men's participation can lead to sustainable population growth. So sir, can you throw some light on this?
Yeah, I just mentioned in the last thing that when women are empowered, then they will not have more children. So empowering women is through education, and if they're able to be economically occupied, that means they're able to earn some money, then it gives them much more power to take decisions which they want to take. And this is what is happening, and this is what is going to happen in the future. Because you've seen what is happening in Japan, empowering the women and educating them, and they have reduced their population, and they need to import people to take up some of the jobs which they don't have enough people to do. So this is what is happening.
So I think sir again has talked on this perspective very well, and what I also personally feel that this empowerment also needs the men's cooperation. So it is always great to have men by our side who encourage the empowerment of women, and Dr. Barman leads the way in that light, and so actually we are very, very proud of him. So sir, what do you think, do you have any more thoughts on this population stabilization besides women, including women, and or maybe encouraging the children at a very younger age on these perspectives? Do you feel anything more can be done for the society?
Certainly, much more can be done by spreading information around, which we did through 2 TV serials. One was Project Viram, which we did with India Today, in which we brought a series of TV programs on the importance of population stabilization. And then we had with Vion company, Vion TV, that has the TV circulation, about population stabilization. So spreading awareness to people is one of the big things that need to be done, and that we are also trying to do. And now TV is no longer the greatest information giver. Now you've got all these social medias and artificial intelligence, Instagram, LinkedIn, all these things are to be used to inform people about things and to give them alternatives to whatever they are doing. And this is only to save themselves. Because the youth, if it takes action, it can take action to save the planet from further deterioration. And that is what Mobius Foundation's main aim is to encourage people to do something to prevent the planet from deteriorating any further than it has already done. The deterioration has come due to the population explosion from 1 billion to 8 billion. But can the Earth support 8 billion at the rates of consumption which the US is consuming, which we aspire to consume to? It cannot. It requires 5 planets to do that. So these are the issues which people have to recognize, that these are the issues, and they will automatically start doing something about it, because we have to provide solutions also. When we are having a documentary series which will provide solutions for each of these things which are destroying the Earth. If the Earth is destroyed, then there's no question of population. So that is the most important thing.
Yes, so these are extreme words of wisdom. So, like as I sit here, I'm trying to hide my delight and keep a straight face because I have to run the show. But I'm sure there are a lot of eager people in the audiences of all age groups. So anybody wants to put up a question to Sir, Mr. Barban? Anybody wants to ask anything? So can you?
Yes, go ahead. You need a mic? Can someone supply a mic?
Please.
Mr. Saxena, we can't hear you.
Thank you for giving this opportunity to ask the question from Mr. Burman.
So you can introduce yourself for the benefit of others.
Well, I'm Mohanji Saxena. I have worked with Mr. Burman for the last 35 years. And he is my guru. And he has inculcated this sustainability in us and in organization. And I'm very happy that this his desire to do something through population control is very much bringing result also. Now the question, sir, what I have is, it's not about the population stabilization, it is about population density management in our country, which is bringing the disasters. Because per square meter area population, if we see for the country, you will find that there are areas where the population density is so low and natural resources to survive are still there. But because of the policies that jobs are there only in the metros, you find the population density reaching to a point where it is unsustainable and it is giving up in terms of the infrastructure, not able to cope that high population density. So my question is, sir, in the time to come, will there be any focus based on population density based interventions which would be useful for government to follow it as a policy to bring short-term relief about the population stabilization program, sir?
Certainly, that is what is being done. But if all the jobs are in one place, people are flocking only for the jobs. Now, how can we transfer this to the rural areas where the people are, even now, 64% of the people live in the rural areas in agriculture. But they're coming into the urban areas only for jobs, so to be gainfully employed. If we can try to do some jobs which are what you call green jobs in their area, then they will be encouraged not to come. So that is what we're trying to do. It's a very difficult job, it's not so easy. So we're trying to do that, but let's see how well we can succeed. The problem is that people want to stick together. They want to have the cinema together, they want to have the theatre together, they want to have this together. You can't do that in a village and see everything together. So you've got to accept some things and you have to try to do something. So both these things go hand in hand, and whatever we can do, we will eventually do, and the government is well aware of that and doing so also.
So I've got a filler from the from the sponsors that perhaps there's more to come, and what Sir's efforts will be showcased in the next plenary session. So with that, I would thank immensely Sir for his time and for his expressive information and thoughts, and I am sure that all the august audience here benefited from his ideology and his talk. Thank you.
Thank you so much, sir. And before you leave the stage, I request Mr. Burman to please felicitate Dr. Sonalikar, so by presenting her a memento. So may we please have the memento on the stage?
You have to do that.
Yes, sir. A small recognition and acknowledgement and remembrance from Mobius Foundation to her. Let's have a round of claps, my dear friends. Thank you so much, sir. And it was lovely, very much insightful. And now we are starting with our panel discussion. Yes, and this panel discussion is going to be on showcasing experiences from ground zero. It's always important to see what is happening at ground zero, because when we are sitting somewhere else and we are planning and strategizing for the things, at that time sometimes we may miss out on the pointers that are affecting the ground zero. So it is going to be really interesting to know that how the experiences from ground zero are affecting this subject. So in this we are going to have the esteemed panelist and the moderator. But firstly, I would like to invite on the moderator of this session. She is going to give you a presentation about this subject, and after that presentation she'll be inviting the panelists to take it up further. So I would like to invite the lead and state head of PFI, Ms. Shilpa Nair, on the stage. Please put your hands together for her. So ma'am is going to give a really wonderful presentation, and I know that is going to be beneficial for all of us on the subject. Ms. Shilpa Nair on the stage. Let's have a round of applause for her. this, ma'am?
Yeah.
Thank you. From one Shilpa to another. Thanks so much. So a very good afternoon to everybody. And a very, following Mr. Burman's session, we are just going to talk about the initiatives which, with his guidance and with Mobius' support, are being implemented on the ground in Uttar Pradesh and also in Bihar. So there are two projects basically which are being implemented under Mobius' Akar initiative. One is being implemented in Uttar Pradesh across 7 districts by the Population Foundation of India. The second one is being implemented by Janani in 1 district each of Uttar Pradesh and Bihar. Now this promises to be an interesting session क्योंकि एक तो इसमें हिंदी और इंग्लिश का मिक्स होने वाला है और हम थोड़ा हिंदी में बात करेंगे, थोड़ा इंग्लिश में बात करेंगे और दूसरा हमारे जो पैनलिस्ट हैं वो डिफरेंट वर्क प्रोफाइल्स लेके हमारे साथ अपने एक्सपीरियंसेस शेयर करने आने वाले हैं. बट बिफोर गेटिंग इनटू दैट आई विल हैव अ फ्यू स्लाइड्स टू शेयर ऑन द उम्मीद प्रोजेक्ट विद यू. सो लेट्स गो विद दैट. All right. So we've been, many of us may have very often been listening to or reading about this conversation. Ki India may, we have achieved the total fertility, replacement level fertility rate of 2.1. Overall, yes, we have. तो क्या फिर family planning programs की कोई importance है? Like Mr. Burman was just saying, yes, extremely important. Couple of reasons for that. One, though most states and districts may have achieved TFR of 2.1, there are still many districts and pockets, large geographies in states like UP and Bihar, where women continue to have 3, 4, 5 children. And this cohort, this group of population, this is largely also socially, economically quite backward. So yes, they need our support, they need our services, they need our empowerment, like Mr. Burman just said. And secondly, even if we have achieved the TFR of 2.1, there continue to be a lot of young people. India is a young country, haven't we heard that often? So we know from data that we have a lot of youth, we have a lot of adolescents, all of them will be stepping into adulthood very soon. And if we need to sustain the ground that we have gained in the family planning program, we need to continue to educate the young. We need to continue to have the family planning services going for all the young people who are going to be coming into the adulthood very soon. So with this picture in mind, let's talk about Uttar Pradesh. UP is still behind the national averages when it comes to family planning. We can see, I'm not going to read the entire data, but I think most of us would have read it somewhere or heard about it in conversations. We still have a lot of unmet need. We are way behind use of modern contraceptive. We still have a lot of unmet need, which means there are couples, men, women, who want to adopt a method of family planning, but वो कर नहीं पा रहे हैं. For some reason or the other, either they have some issues which are unresolved in their mind, or the services are not reaching them. We continue to have a higher fertility rate, 2.4 तो overall UP का average है. But the districts where under Akar we are working, Umeed is working, those districts have a much higher TFR. Many of them are even on the Nepal border. So those are really needy places. Barriers are on both sides, both on the demand side and on the supply side. So the ability to actually reach everyone with information. So many population pockets still have a lot of myths and misconceptions in their mind about different contraceptive methods. They still are not clear कि क्या है, क्या नहीं है, very scared to adopt a method. वो तो है ही. There is also social norms, practices, like we continue to be obsessed with male children. We continue to have those practices. There are many districts where child marriages are still very common. Very common. One of our districts, every second girl is getting married under the age of 18 years. So that's the other one. And on the supply side, yes, there is, in the outreach areas, there is in many districts a dearth of enough staff, enough resources, and the ability to reach every household with family planning services. Move on. All right, so now let's talk about our districts, those 7 districts which are really the needy districts. We have here Balrampur, Barabanki, Gonda, Sitapur, and now Bahraich and Shavasti. Those of you who are familiar with UP would know that most of these are quite remote. barring Unnao and Barabanki. But in these districts, like I said, most women continue to have, the TFR is much higher. It's in the range of 3+ or 4+. In Bahraich and Shravasti, you can see that teenage childbearing is very high. In the use of modern methods of contraception is very low. And in Bahraich and Goda, there are several women there who want to adopt a method of family planning but have yet not been contacted by a health worker. So when we stay in urban India, we often think, "Arey, aaj ki problem to kya hai? Infertility hai." Right? In urban India, we are facing that problem. But here, in the rural areas, we continue to have the same problems as before. Reach of correct information, reach of complete and correct services is a problem still. Next one. So when we started working first, we started work from one block with Mobius' support. That was Jarwal block in Bahraich district. In 118 villages we started. And within 1 year, again under Akar, we expanded to 7 districts, and the Umeed project grew to covering 50 blocks across 7 districts and a huge 1.25 crore population. We are currently directly working with over 13,000 Ashas and ANMs, government workers who work at the grassroots level. Next one. How are we doing this? One, we're trying to increase access to family planning counseling. And to do this, we have 102 health facilities, government hospitals, where with the government's agreement and collaboration, we are establishing family planning counseling corners. Which means that all those people who are coming on a daily basis for OPD services in these government hospitals also have access to family planning counseling through these corners, where a number of informative tools have also been kept, and the government staff has been properly trained to do counseling without being judgmental, without losing patience, without being prescriptive. Secondly, building the capacity of all the Ashas and ANMs in the field and the facility staff who are working in the outreach areas. So if you have heard of primary health centers, sub-health centers, community health centers, and district hospitals, that's the structures that we have in the rural areas for providing services. Several workers and different cadres are being trained under Umeed, like the pharmacists are being trained to properly predict the family planning supplies of contraceptives that they will be needing, so that there's no stock out. The Ashas and ANMs are being trained in counseling. A separate cadre of counselors is being trained. All the staff nurses are being trained. So different people are being trained. The community health workers are being trained, who run the Arogya Mandirs, Ayushman Arogya Mandirs under the government's National Health Mission. They are being trained, all of them, to provide sensitive, quality family planning information and services. Another effort that we're doing is interdepartmental convergence, meaning why should just the health department be bearing the burden of promoting awareness on family planning or promoting awareness on contraceptives and mobilizing communities? Because the health department has more than, I think, 60+ programs where they're not just generating awareness, they're providing services. And there is always a dearth of staff. So other departments, and it is in their mandate, it's in the mandate of the Women and Child Department, it's in the mandate of the Education Department, and the mandate of the Panchayati Raj Department to actually work on family planning. So that is something which we are bringing forward, that we're just not establishing anything new. Whatever exists in the government policy, we're just bringing it to the forefront and trying to get that going between departments so that there is more support for at least mobilizing communities, for at least generating awareness. एक आंगनबाड़ी worker भी कर सकती है, एक प्रधान भी कर सकता है. These people can also participate, and school teachers and school principals can also participate if addressing child marriage is an issue. Lastly, and this has been Population Foundation of India's strength, we do have a lot of experience in developing and running social and behavior change communication campaigns. आप में से कुछ लोगों ने अगर कभी याद रखा हो कि मैं कुछ भी कर सकती हूँ was a major campaign of PFI which was run across several television stations across the country and translated in several languages. So now here also, as part of the Umeed project, we are developing social and behavior change communication campaigns. One of them I'll be talking about, and some of the panelists will be talking about, and trying to, generate a kind of a mass enthusiasm, and also, break this silence around family planning. कि ये तो कुछ बहुत हश-हश चीज़ है जिसके बारे में बात नहीं की जा सकती, या ब्रेक दैट स्टीरियोटाइप कि ये सिर्फ विमेन का ही रिस्पॉन्सिबिलिटी है, मेन इसमें कुछ नहीं करेंगे, men don't play a role. So we're trying to address a number of those kind of issues through these campaigns. Next one. Okay, just coming to a little more details. I will not read out every figure and all the details. The family planning counseling corners that have been established in these government hospitals, they have been a great learning for us. I think they have given us good results, and in just about a couple of months since we have established these corners, we've had more than 30,000 clients who've been counseled there, and a huge number of them, you can see, have started availing services. So this clearly proves, and this is all government data, this is not data which the project is keeping, we're using the government data to say this has made a huge difference to the uptake of family planning services from the government hospital itself. So the support has been from the outside, but working together from the inside. Next one. Similarly, if you talk about convergence, there have been committees which have been established at the block levels and at the district levels. Specific forums with specific membership have been established. Now these committees are also working quite well, as in bringing the different departments together to play a role in generating awareness. Next one. Similarly, with frontline workers, like I've already said, we've been working with more than 13,000, and it's a real effort to track, train, bring them together in different batches and train them and follow them up and keep in touch with them and keep up a high sense of motivation. Just a quick word here about what they was really lacking with them was most Ashas have been working for more than 20 years, and they were trained initially on family planning when they joined. Since then, a lot more has happened in the last 2 decades. New contraceptives have come in, and there was a need to train them and to also build their confidence on the new contraceptives so that they could actually take on the questions and the concerns that the community has. Next one. This is interesting, and I'm just going to stop here because this slide is self-explanatory. You can see there are a number of major different things that have been developed. A campaign called Itni Bhi Kya Jaldi Hai, शादी की इतनी क्या जल्दी है, बच्चे करने की इतनी क्या जल्दी है, एक बच्चा हो गया तो दूसरे की क्या जल्दी है. That's the campaign which is currently running across UP in the 7 districts, in the field. I'm going to quickly ask Shobha to play you one of the films that is running there through the mobile vans that are moving around in the villages.
मेरा चश्मा कहाँ गया? कहाँ रह गया था रमेश?
पापा,
क्या हुआ?
कुछ नहीं अम्मा, बाजार में चौधरी साहब मिले थे, स्वाति की शादी की बात कर रहे थे.
अपनी स्वाति की अभी उम्र ही क्या है?
तुम्हारी तो इससे भी कम उम्र में शादी हो गई थी ना अम्मा?
हाँ, हुई तो थी, पर कभी कभी सोचती हूँ मेरा बचपन जैसे छूट ही गया. अगर माँ बाप ने थोड़ा इंतजार किया होता तो शायद मैं अपने कुछ सपने देख पाती, उन्हें जी पाती.
पर अम्मा, मेरी भी कुछ जिम्मेदारियां हैं.
हाँ, हम सबकी जिम्मेदारी है, पर उसे काबिल बनाने की, ताकि वो पढ़ लिख कर अपने पैरों पर खड़ी हो जाए और अपने सपनों को जी पाए.
पापा, मेरा स्कूल टीम में सिलेक्शन हो गया. हमें लखनऊ जाना है खेलने. ये
इतनी दूर? ना, इतनी दूर अकेले जाने जितनी बड़ी नहीं हुई हो तुम अभी.
लखनऊ अकेले जाने को स्वाति अब तक बड़ी ना हुई, पर ब्याह कर दूसरे घर जाकर घर गृहस्थी बच्चे संभालने के लिए तैयार हो गई है ना?
तैयार मतलब?
तैयार मतलब मानसिक और शारीरिक रूप से सक्षम होना, इस काबिल होना कि जिंदगी के मुश्किल फैसले समझदारी से ले सको, हर चुनौती का सामना कर सको, है ना रमेश?
मैं चलूंगा तुम्हारे साथ. जब तक तुम बड़ी जिम्मेदारियां लेने के लिए तैयार ना हो जाओ, तब तक मैं दूंगा तुम्हारा साथ.
और शादी?
उसकी इतनी भी क्या जल्दी है?
वही तो, इतनी भी क्या जल्दी है?
Okay. So I think we're running behind schedule. We will just some photographs from all the work in the field, which I'm not going to read out in detail. But just to say that a huge number of villages are being reached through the mobile van video shows. and a lot of other programs, a lot of media engagement is happening in the field, just so that there's a lot of buzz around the issue of family planning. So with that, I think we'll come to the end of our topic, and we will start with our panel discussion, and we will invite, मैं invite करूँगी अपने सारे panelists को कि please आएं stage पे और हमें join करें. एक इंट्रोडक्शन छोटा सा अपने पैनलिस्ट के साथ. हमारी पहली पैनलिस्ट हैं मिस शैल कुमारी, जो कि आशा हैं त्रिवेदीगंज से, बाराबंकी से, और 20 साल से ऊपर से आशा हैं. और शैल कुमारी जी का जो डेडिकेशन है उसकी वजह से उनको रिसेंटली अवार्ड भी मिला है अपने डिस्ट्रिक्ट में बाय द डिस्ट्रिक्ट मजिस्ट्रेट. बहुत सारे इनके फैमिली प्लानिंग के क्लाइंट्स हैं और इनसे हम सुनेंगे इनका एक्सपीरियंस. The second panel member that we have is Miss Sapna Tiwari, जो कि स्टाफ नर्स हैं CHC त्रिवेदीगंज से, बाराबंकी से. स्टाफ नर्स होने के साथ साथ सपना इस समय डेजिग्नेटेड फैमिली प्लानिंग काउंसलर भी हैं, जिन्होंने एक ट्रेनिंग ली है उम्मीद में, और 1000 से ज़्यादा अधिक की डिलीवरी करा चुकी हैं, 500 से ज़्यादा IUCD इंसर्शंस करा चुकी हैं. सो शी इज़ अनदर अवार्डी. अपने ज़िले में इनको भी एक परफॉर्मेंस के लिए अवार्ड मिला है. वी हैव डॉक्टर अमित कुमार, मेडिकल सुपरिटेंडेंट, छपिया CHC से, गोंडा डिस्ट्रिक्ट से, और डॉक्टर कुमार पेडिटिशियन हैं 18 ईयर्स से, बट ही इज़ ऑल्सो हेडिंग द कम्युनिटी हेल्थ सेंटर इन छपिया इन गोंडा डिस्ट्रिक्ट. और डॉक्टर कुमार का बहुत एक्टिव सपोर्ट रहा है इन ऑल द प्रोग्राम, बट स्पेशली इन द उम्मीद प्रोग्राम, और जो हमने इनके साथ मिलके वहाँ पे अचीव किया है वो डॉक्टर साहब शेयर करेंगे. मिस्टर BK जैन, जो एक्स जनरल मैनेजर हैं सिफ्सा से और नेशनल हेल्थ मिशन से, उत्तर प्रदेश से, क्लोजली एसोसिएटेड नाउ विद उम्मीद ऑल्सो. ही इज़ हेल्ड सम वेरी सीनियर पोजिशंस, और इनका मेन वर्क रहा है रिसर्च, इवैल्यूएशन, मॉनिटरिंग और इंफॉर्मेशन टेक्नोलॉजी. सो वी विल स्पीक टू हिम एज वेल. एंड वी हैव मिस्टर रिचर्ड बॉस्ट्रेट, country director of Janani, with over 27 years of global sexual reproductive health experience, leading Janani's work in expanding access to family planning and safe abortion in India. Richard has held leadership roles at DKT, MSI and IPPF, and served as country director in 8 countries. So he brings in a lot of program expertise to the table. Thank you so much. आप लोगों का स्वागत है, और शुरू करते हैं हम शैल कुमारी जी आपसे. तो थोड़ा बताइए शैल जी अपने बारे में, आपके आशा का, एज आशा आपका क्या है, काम क्या है, कैसे कर रही हैं, दिनचर्या कैसी रहती है?
जब हम शुरू में आशा बने थे 2006 में, तब इतने अच्छे हालात नहीं थे. हम लोगों को बहुत कम उम्र में शादी हो गई थी, गांव गली मालूम नहीं था, घूंघट निकाल के जाना पड़ता था, पति का सहयोग लेना पड़ता था, और गांव के लोग बहुत ताने कसते थे कि रोज रोज बैग टांग के घूम रही है, कहाँ जा रही है, और इसको कुछ काम धाम है नहीं, पैसे कमाना है केवल. लेकिन इसको देखते हुए हम लोग हार नहीं माने और आगे बढ़ते गए. और यही आज वो लोग हम लोगों से डिस्कस करते हैं, सारी बातें करते हैं, कोई बात होती है तो हम लोगों से पूछने आते हैं और सलाह करते हैं. और लगभग आशा के कार्यक्रम में लगभग 70 से 72 कार्यक्रम चलते रहते हैं, जैसे मातृ एवं शिशु स्वास्थ्य है, टीकाकरण है, परिवार नियोजन है, फाइलेरिया है, मलेरिया है, दस्तक संचारी, बहुत से कार्यक्रम चलते रहते हैं, चाहे सर्दी हो या गर्मी हो. लेकिन हम लोग हार नहीं मानते हैं, घर घर जाते रहते हैं और हम लोगों को जाना ही पड़ता है.
तो शैल जी, बहुत सारे कार्यक्रमों के बीच में आपको अवार्ड मिला है परिवार नियोजन पे काम करने के लिए, उसके बारे में थोड़ा सा बताइए.
जी, सच कहूँ तो ये परिवार नियोजन जब हम लोग 2006 में आशा बने थे, तब हमारी शुरू में ट्रेनिंग हुई थी, लेकिन इतना कुछ हम लोगों को पता नहीं था. कुछ बातें थी कि परिवार नियोजन के बारे में किसी को बता नहीं पाते थे, समझा नहीं पाते थे. जैसे अब नए साधन आए हैं, नए नए बदलाव हुए हैं, लेकिन जैसे छाया आया है, अंतर आया है, लेकिन इन लोगों के बारे में हमको कुछ पता नहीं था. जैसे कोई पूछता था या कोई साइड इफेक्ट हो जाता था तो हम लोग बता नहीं पाते थे. वैसे मैंने अपनी दौरानी को लगवा दिया अंतरा, और उसको हाई ब्लीडिंग होने लगी. जब वो मेरे पास आई तो हम उसको समझा नहीं पाए, सही से बता नहीं पाए, वो नाराज भी हो गई, उसने अंतरा लगवाना बंद कर दिया. उसके बाद जब ये उम्मीद परामर्श उम्मीद परियोजना की जब ट्रेनिंग हुई, तब उसमें हमको बहुत जानकारी मिली, हमारा आत्मविश्वास बढ़ा और हम बेझिझक होके उसके पास गए, उसको समझाए। अब वो अंतरा लगवाने लगी, तीसरी डोज उसको लग रही है। और यही नहीं मैम, इस ट्रेनिंग के बाद हमने 23 नसबंदी करवाई हैं, 17 आईसीडी लगवाई हैं और हमारे 10 छाया के क्लाइंट है और 10 हमारे अंतरा के क्लाइंट है जो बराबर वो गोलियां ले रहे हैं। और यही नहीं, जो हमने 23 नसबंदी करवाई है उसमें हमने 7 2 बच्चों वाली नसबंदी करवाई है और उसमें 1-2 बेटियों वाली है, जो कि गांव में इतना आसान नहीं है मैम कि हम लोग 2 बच्चों पे नसबंदी करवा सके। लेकिन ये कमाल इसी का है, उम्मीद परियोजना का कमाल है, जो इस ट्रेनिंग के बाद हमको जानकारी मिली और हम सबको अच्छे से बता पाए, इसीलिए हमको अवार्ड मिला और हम इतनी ऊंचाई पे आ पाए।
हमें लगता है कमाल आपका भी है, जो आपने ट्रेनिंग बहुत लोग लेते हैं, पर जो ट्रेनिंग आपने अपने अंदर उसको लिया, उस लर्निंग को लिया और जिस कॉन्फिडेंस और मोटिवेशन से आपने उस पर कार्य किया, वो सराहनीय है। थोड़ा सा ये बता दीजिए बस कि इतनी भी क्या जल्दी है में गांव के स्तर पे आप उसको कैसे चलवा रहे हैं कैंपेन?
जी, इसका नाम इतना सुंदर है, इतनी भी क्या जल्दी है, कि लोग इसमें जुड़ी जाते हैं और हम लोग 4 बिंदुओं पे चर्चा करते हैं। शादी की इतनी भी क्या जल्दी है, पहले बच्चे की इतनी भी क्या जल्दी है, और पहला बच्चा हो गया तो दूसरे की इतनी भी क्या जल्दी है, और आपातकालीन गोली के विषय में बात करते हैं। और अपने मोबाइल पे हम लोग फिल्म, गांव में जाते हैं घर घर तो फिल्म दिखाते हैं, कोई बैठक होती है तो उसमें दिखाते हैं, बियाचंडी में दिखाते हैं। और उसके बाद जब हमारे यहाँ ये मोबाइल वैन आती है तो हम लोग गांव वालों को इकट्ठा करते हैं और सबको फिल्म दिखाई जाती है, रील्स दिखाई जाती है, गाने सुनाए जाते हैं और फिल्म के थ्रू जो चर्चा होती है उस पर हम लोग सवाल करते हैं और उस सवाल का जवाब जो लोग सही दे देते हैं उनको छोटे छोटे हम लोग इनाम देते हैं, क्योंकि वो आकर के इसमें भाग लें, उत्साहित बने। और जो लोग जैसे मान लो कोई साधन अपनाना चाहते हैं, रुचि दिखाना चाहते हैं, तो हम उन लोगों को मालायन है, कंडोम है, छाया है, उनकी काउंसलिंग करके हम लोग उनको देते हैं। और जिसे कोई चाहता है कि हम आईसीडी लगवाएं, अंतरा लगवाएं या नसबंदी करवाएं, तो उनको अपने सीएससी पर बने उम्मीद परामर्श केंद्र पे ले जाते हैं, वहाँ सेवाएं दिलवाते हैं।
थैंक यू, बहुत अच्छे से बताया आपने हमको। ये उम्मीद परामर्श केंद्र की आपने बात करी, तो हमारी जो नेक्स्ट पैनलिस्ट हैं वो काउंसलर हैं उम्मीद परामर्श केंद्र में, और उनसे हम लोग जानेंगे, और वो भी एक अवार्डी हैं। सपना जी, आप भी एक अवार्डी हैं, आपको भी अवार्ड मिला है डिस्ट्रिक्ट में।
जी मैम, हम अपने अवार्ड के बारे में बता रहे हैं मुझे कैसे मिला। हम अपने स्वास्थ्य केंद्र पर जो काउंसलिंग की सुविधा है इसको सही विधि से करते हैं और जारी रखे हैं। तो पहले तो मैं स्टाफ नर्स थी, लेकिन उसके बाद जब ये उम्मीद काउंसलिंग कॉर्नर शुरू हुआ तो इसमें हमें और हमारे साथियों को जो काउंसलर के लिए चुना गया, और ये पॉपुलेशन फाउंडेशन ऑफ इंडिया की तरफ से हमको इसका प्रशिक्षण मिला। तो मैम पहले तो हमारे स्वास्थ्य केंद्र पर कोई काउंसलिंग की ऐसी सुविधा नहीं थी। हम लोग अपने काम के साथ साथ अगर किसी को ज़रूरत है तो हमने परामर्श दे दिया या फैमिली प्लानिंग का साधन दे दिया, नहीं तो फिर अपने कार्य में व्यस्त रहते थे। लेकिन जब से हमें और हमारे 2 साथियों को काउंसलर चुना गया, तब से हम लोग अपने कार्य के साथ साथ और जो है परिवार नियोजन के साधन के बारे में परामर्श देते हैं, जिसके कारण हमारे जो क्लाइंट हैं परिवार नियोजन के वो बढ़ते जा रहे हैं। तो मैम हमारी सीएससी पर लगभग प्रतिदिन 200 से 250 के करीब ओपीडी चलती है। तो इसमें मैम जब से उम्मीद काउंसलिंग कॉर्नर शुरू हुआ है, लगभग 9 महीने हो रहे हैं, तो हम अपना रिकॉर्ड बता रहे हैं मैम कि हमने करीब 700 से 800 लोगों की काउंसलिंग किया और मैंने 537 डिलीवरी कराई, जिसमें हमने 247 लोगों को आईसीडी इंसर्शन किया।
तो बहुत स्पष्ट है कि अवार्ड आपको क्यों मिला है।
जी, जी। और जो 22 अंतरा के क्लाइंट्स थे, इसी के चलते मैम हमको अभी जल्द ही स्टार काउंसलर का अवार्ड मिला है।
तो ये थोड़ा सा परामर्श केंद्र ये काम कैसे करता है, थोड़ा संक्षिप्त में ब्रीफ में बताइए कि परामर्श केंद्र काम कैसे करता है।
जी, ये परामर्श केंद्र तो बहुत अच्छी तरीके से मैम काम कर रहा है, जहाँ पर हमारी दिन में ओपीडी चलती हैं और हमारी महिला डॉक्टर जहाँ पर बैठती हैं, जस्ट उसी के सामने हम लोग का ये उम्मीद परामर्श केंद्र बना हुआ है। तो पहले तो मैम हम हमारे जो 2 साथियों को काउंसलर की ट्रेनिंग मिली थी, हम ही लोग इसकी काउंसलिंग करते थे, परामर्श देते थे लोगों को। लेकिन अभी सबसे अच्छी बात यह है कि हमारे पूरी स्वास्थ्य केंद्र के समस्त स्टाफ, जिसमें आरबीएस के टीम के जितने स्टाफ होते हैं और महिला डॉक्टर हैं, वार्ड बॉय हैं, फार्मासिस्ट हैं, एएनएम हैं, आशा, स्टाफ नर्स, सबको इस ट्रेनिंग दी जा चुकी है। तो जो भी क्लाइंट महिला या दंपति जो भी मैम के पास आते हैं, पहले तो हम लोग के पास परामर्श केंद्र पर भेजती हैं, हम लोग उसकी काउंसलिंग करते हैं। उसके अलावा अगर कोई भी क्लाइंट्स अदर स्टाफ के पास भी जाता है
तो बेसिकली मैं आपको थोड़ा सा समय की वजह से इंटरप्ट करें, तो बेसिकली हम ये कह रहे हैं कि जो परामर्श केंद्र, जो हमारे गायनेकोलॉजिस्ट के पास भी जो लोग आती हैं लेडीज, वो सब परामर्श केंद्र पे भी परामर्श
परामर्श मिलता
है।
और
आप लोग सब मिल के उस केंद्र को चला रहे हैं, उसको संचालित
चला रहे हैं। मैम एएनसी के टाइम से ही परामर्श शुरू हो जाता है,
से ही शुरू
जी एएनसी से ही शुरू हो जाता है और हमारा पूरा स्वास्थ्य केंद्र इस परामर्श केंद्र से जुड़ा हुआ है। तो जो क्लाइंट्स 9 महीने में डिलीवरी के बाद आते हैं एएनसी से स्टार्टिंग होके, तो उनको फैमिली प्लानिंग का साधन चुनने में कोई आपत्ति नहीं होती,
तब तक वो मेंटली तैयार
जी। और इसका फॉलो अप भी बहुत अच्छे तरीके से हो रहा है। हम अपनी आशा के द्वारा उनके जो है रिकॉर्ड को साझा करते हैं, जिससे हमारा फॉलो अप समय से होता है। अगर कोई दिक्कत होती है तो हम आशा के द्वारा फैमिली प्लानिंग का साधन भी पहुंचा देते हैं।
और इससे बस थोड़ा सा हमारा टाइम का कंस्ट्रेंट चल रहा है, तो आपको थोड़ा सा बीच में रोक रही हूँ। डॉक्टर साहब, आपसे एक सवाल पूछूंगी मैं। डॉक्टर अमित, आप सीएचसी को हेड करते हैं, उसको देखते हैं, तो थोड़ा बस इतना सा जानना चाह रहे हैं कि क्या लगता है आपको कि काफ़ी कुछ कार्य हमने किया है, साथ में मिलके बहुत कुछ कार्य किया। शुरू में आपका रिएक्शन थोड़ा सा वो रहता था कि ये क्या एडिशनल काम लेकर के आ गए आप लोग, पर उसके बाद से आपने उसको, बल्कि जो सेंटर है उसको हमने एक टेम्प्रेरी कियोस्क से निकाल करके डॉक्टर साहब ने उसको एक परमानेंट स्पेस, एक रूम दिया आपने यहाँ। डॉक्टर साहब, और क्या कर सकते हैं हम? थोड़ा सा जल्दी से बात करेंगे, आई पोज स्मॉलर क्वेश्चंस, कि और क्या कर सकते हैं हम?
जो इसमें धन्यवाद पहले आपका। मैं पीडियाट्रिशियन हूँ और एक बहुत ही रूरल ब्लॉक है गोंडा का छपिया, एग्जैक्टली 55 किलोमीटर दूर है। अगर हम बस्ती से दूरी देखें हेडक्वार्टर से, वो भी 55 है। गोंडा से, फैजाबाद से देखें, वो भी 55 है। और गोंडा जिस डिस्ट्रिक्ट में छपिया है वो भी लगभग 55 किलोमीटर है। काफ़ी रूरल एरिया है। और मैं लखनऊ, मेरा घर है, और मैं रह के ही ईमानदारी से सेवाएं दे रहा हूँ। लगभग 18 साल हो गया जॉब करते हुए, अभी 20-20 साल लगभग बाकी भी है। बहुत पहले जॉब में आ गया था मैं। तो मैंने जब हमारे यहाँ उम्मीद परियोजना को लेके डिस्ट्रिक्ट वाले आए, तो मैंने सोचा कि भाई ये काम और बढ़ गया, और कई परियोजनाएं, कई लोग आते रहते हैं, तो ऐसा लगा कि ये सस्टेन नहीं हो पाएगा और ये भी एक परियोजना योजना की तरह चला जाएगा। बट जैसे जैसे लोग हमारे साथ कार्य करते गए, फिर हमारे जो स्टाफ थी, हालांकि कोई फैमिली काउंसलिंग के लिए, फैमिली प्लानिंग काउंसलिंग का कोई स्टाफ नहीं था, बट हमने एमएससीपी स्टाफ को उठाया, लेबर रूम स्टाफ को यूज़ किया और उसको हमने फैमिली प्लानिंग के काउंसलिंग में लगाया। और इस तरह से उम्मीद का जो साथ हमें मिला है, तो हमारे स्टाफ में उत्साहवर्धन हुआ और लगातार कार्य में सुधार होता ही जा रहा है। और हम अभी भी अच्छे जगह जा रहे हैं। गोंडा में हम लगभग हमेशा सेकंड थर्ड ही रहते हैं, और आगे हम चाहते हैं और ब्लॉक में भी जो रूरल एरियाज़ के ब्लॉक हैं, कुछ डिस्ट्रिक्ट्स हमारे, जैसे अभी बात हुई श्रावस्ती, बहराइच या अन्य डिस्ट्रिक्ट्स हैं, वहाँ पे बहुत ही अंदर के एरिया, वहाँ कॉन्टेस्ट स्पेसिफिक चैलेंजेस है, तो वहाँ पर भी काम करने की बहुत ज़्यादा ज़रूरत है। और हम चाहेंगे कि अभी और जारी रहे आगे, और इसका सहयोग होना ही चाहिए, क्योंकि असर तो पड़ा है।
थैंक यू सो मच डॉक्टर साहब। मिस्टर जैन, आपसे पूछना चाहूँगी, सस्टेनेबिलिटी के लिए व्हाट मोर कैन बी डन, कि हमारी जो इंटरवेंशंस हैं वो लॉन्ग टर्म में सस्टेन करें?
देखिए, जहाँ तक सस्टेनेबिलिटी का सवाल है, मुझे लगता है कि ये इस प्रोजेक्ट में, जो कि गवर्नमेंट हेल्थ सिस्टम की स्ट्रेंथनिंग का ही एक प्रोजेक्ट है, ये इसमें इनबिल्ट है। एंड इसमें गवर्नमेंट के ही स्टाफ को इस प्रोजेक्ट के अंदर आप लोग ट्रेन कर रहे हैं, चाहे वो फ्रंटलाइन वर्कर्स हों, आशाज हैं, एएनएम हैं, सीएचओज हैं, हेल्थ फैसिलिटी का स्टाफ है। आप सप्लाई एंड डिमांड साइड को इम्प्रूव कर रहे हैं। देन जितने भी आपके एसपीसीसी कैंपेन हैं, उसमें गवर्नमेंट का स्टाफ ही इसमें अगर देखें तो एक तरीके से यूज़ हो रहा है। इसमें सस्टेनेबिलिटी का, जहाँ तक डॉक्टर अमित ने कहा कि ये लॉन्ग टर्म थोड़ी सी प्लानिंग होनी चाहिए। ये 2 साल 3 साल में हम वो सिस्टम में एम्बेड हो जाए, वो हम नहीं अचीव कर पाएंगे अनटिल अनलेस इट इज़ मोर देन 5 ईयर्स या 5 ईयर्स का मिनिमम वो पीरियड होना चाहिए। और जहाँ तक कुछ सीएमओज ने अभी फ़िलहाल अभी लिख कर दिया है कि जो रिमेनिंग 44 ब्लॉक्स हैं, इसमें इसको स्केल अप कर दिया जाए। तो जो इसमें जो इनबिल्ट स्ट्रेटजीज़ हैं और जो इसमें सारे कंपोनेंट्स हैं, वो गवर्नमेंट सिस्टम को स्ट्रेंथन ही कर रहे हैं।
Thank you. Richard, we come to you. And please tell us about the Janani work in UP and Bihar. And basically we've been talking about population stabilization. And there are certain very high fertility districts in these two states. So would you like to tell us how Janani is working in these districts?
Sure. So Janani is primarily a service provider. We work mainly on the supply side. We run 10 clinics in Bihar. And we have 19 outreach teams, and that's what I'm going to talk about in this presentation, is that outreach model. Because I think what we do is very similar to what you've just presented around working with the ushers, the Angawadis and so on in delivering that message out to communities. So in the interest of time, I'm not going to focus on that. I'm going to focus on the service delivery side. So through this project, which is funded by the Mobius Foundation, we work in two districts, Siratnagar in UP and Saran in Bihar. I think we've touched on this a lot, the impact of population stabilization on environment, how it lowers carbon emissions, reduces deforestation, and so on. So I'm going to skip this slide. So the objectives of the project, again, are to increase awareness, and we assume that increasing awareness that we will increase demand. And those two don't necessarily go hand in hand. So I'm going to talk a little bit about our sister organization, which focuses on social marketing. Social marketing is about using commercial marketing tools and techniques like mass media, like social media, to create demand. So creating, education, people having the information is a crucial step. But I think we need to go a step further and actually create demand, actually create, in the same way that a brand like, let's say, Nike trainers, right? A trainer is just a shoe. We don't want to buy Nike trainers because they're a shoe. We want to buy Nike trainers because there's an image that comes with the Nike brand. And what I'm driving at here is private sector is very good at creating demand for products, and obviously uses mass media, social media, and so on to do that. So I think that's where an extra step that we need to take. Let me come back to this presentation. This is what the key activities, a lot of that's already been covered. Mobilizing communities through the village health, sanitation and nutrition days, through the cluster meetings that happen with government. So it's all about supporting government, training ushers, training Angawadis, and really trying to integrate and strengthen and help support the government system, what the government's already doing. There's a lot of family planning counseling, moving through villages. We'll see some pictures now. Just interacting, door-to-door counseling, working a lot with men to create that enabling environment. But the main one is we have a mobile team, clinical team, doctors, nurses, and so on, that work to support the private sector. So in a lot of the primary healthcare centers in these districts, they don't have the manpower and they don't have the equipment to provide a full range of contraception. And our team is a medical team and will go out on fixed days and provide surgical contraception, IUDs and so on, at the primary healthcare centers on specific days. So we're focusing more on the supply side there. This is just pictures of that one-to-one counseling. Sorry, can we come back? That one-to-one counseling, working with the ushers, working with the Angawadis, and providing counseling directly. The bottom left picture is actually providing tubal ligation services, so sterilization, at government facilities. And those
Richard,
women
I'm
lining up waiting for that
sorry
procedure.
to interrupt you, but we are really running behind schedule. Can we have some last point if you want to share?
No, so just one thing sorry, next slide. Top right, street theatre is something we found quite successful in putting on skits and plays about love, about relationships, and just weaving family planning messages through that. I think you guys have already covered the mobile van, and yeah.
Thank you. Thank you so much. Thank you. We're running behind schedule, so not much time for questions, I'm afraid, but we can all continue to interact during lunch. So please give a big hand to the panelists. Thank you. And here's handing the baton.
Thank you so much, ma'am. Thank you. It was lovely. And thank you for understanding the interest of time right now. Thanks a lot. And I would like to request Mr. Praveen Garg to please come on the stage to felicitate the panelists. And I request all of you कि आप थोड़ा सा आगे आ जाएं ताकि एक तस्वीर आप सभी लोगों की एक साथ ले ली जाए. There's a time for the photo op, and Shri Praveen Garg is also joining us on the stage for this photo op. It's a photo and then felicitation, both. So may we please have a round of applause for the Galaxy. Now we have got the mementos over here on the stage, so I request Mr. Garg to please present these mementos to the panelists. Yeah, you can just go to sir. Mr. Garg would present it to. Yeah. There's such a moment of encouragement as well, because when you are doing something and you are got acknowledged for that, recognized for that, it actually gives a motivation. Now for Ms. Shilpa Nair. May we have the mementos on the stage for our panelists? Yes. Dr. Amit Kumar. For Mr. Jain. And Mr. Richard. We thank you all for being part of this wonderful session and this international conference. With all your support, we are going to achieve this vision with which we have started this international conference. So once again, I thank you all. Let's have a round of applause for all the panelists over here. Thank you so much. With this, we have come to a time where we are going to take a break, and that's a lunch break. After lunch, we are going to meet over here again, and then we are going to have our next session. So I would like to request you, please be back here right at 1:20 so that we can start our session on the right time. See you on the other side. Thank you so much.